Good afternoon, everyone, and thanks for joining us. My name is Matt Rossler. I'm one of the business development directors here at PROXUS. I, along with all of my colleagues at PROXUS, continue to hope that you, your families, and teams are all doing as well as possible, given the current situation and environment that we are all living with. So a crisis like the one we're experiencing, certainly has and will continue to bring challenges for all of us. But personally, I'm encouraged by some of the more creative solutions that I've seen being developed, whether it's on a business level, professional level, or certainly on a personal level as well, to get us all through this. With that said, PROXUS is always here before the coronavirus, and we will be here during and after as a resource to all of you, and we're happy to have you join us for the next several minutes. A few housekeeping items to be aware of. The webinar today is being recorded. Attendees can submit and should submit questions through the attendee panel that you're going to see on your screen. Any relevant documents that we have at this point that we think would be valuable for you to have been attached to the handout section that's also in your attendee panel. We have about 5 documents up there. Some are Q&As from the Department of Labor. We've got guidance from the EEOC as it relates to the ADA and the coronavirus. The FCRA poster that you are all required to distribute and post in your places of business is up there as well for you, as well as I-9 compliance and the slide deck for today. Again, as I said, please continue to submit any questions that you have as we go through, and we will answer those after the presentation. In addition, while all of our audience members are muted, the presenters for today are not. With us working from home, should you hear any background dog barks, cat meows, or children, we do apologize in advance. With me today, I have a couple of panelists. So I have Chris Cuomo, Principal and Co-Founder of PROXUS, Eileen Lynn, Associate Director of Tax and Treasury, Carol Kellock, one of our implementation navigators, and Linda McFillan, Director of HR and Benefit Administration Services. So each of our speakers will be addressing different areas of either the recent legislation or considerations for how best to manage your teams within your PROXUS iSolve platform for the foreseeable future. A few things that we're going to cover. First, Chris is going to provide us with a PROXUS update on how PROXUS is handling the current environment. We'll go into a little bit of detail about the Family First Coronavirus Response Act. Certainly, we're going to talk about the iSolve capabilities and the way that system has been updated to handle the sick time and the expanded FMLA time. Talk about some important benefit administration considerations, and then certainly go into the questions and answers that have been submitted prior to today's webinar. Based on the volume of questions that we have received and continue to receive just up until a few minutes before we got started here, it is likely that we will go a little bit over the 45 minutes that we had allotted. If you do need to drop off the call, go ahead and do so, and we will send out the recording and the slide deck shortly after the webinar has wrapped up. And lastly, before I turn the mic over to Chris, the information that we are discussing here today is purely for educational purposes only. Here at PROXUS, we do not employ attorneys, and as such, the information presented should not be relied upon as legal advice. If you do require legal advice and you would like the contact information for an employment attorney, I do have a reputable source and a partner that I'm more than happy to recommend if you want to reach out to myself or anyone else within PROXUS at the end of the webinar. With that, Chris, I will turn things over to you.
Thanks, Matt. I appreciate it. Hi, everybody. Just wanted to say, first of all, thanks to all of our partners, our clients, and to the team here at PROXUS for the great work that everybody's been doing as we navigate these uncharted waters. It's a pretty interesting time in the USA right now. So just to give you kind of an update on us as an organization, we have been designated by the state as an essential business because we are in the financial payments space. So we do have a small team of folks here in Fort Washington at our office who are here to be sure that payroll checks are being printed and delivered. A lot of our clients have already been in contact with us as far as alternate delivery, and I'll talk about that in a little bit, but we are here. The rest of the team is virtualized and working from their home offices. As you know, we built our organization over the last few years to be completely virtual, and thanks to cloud technology, we can continue to work and provide the services to you folks as if we were all right here in Fort Washington. As part of our internal procedures, we are holding twice weekly town halls with our team for the purpose of staying connected, as we're not used to working remotely like this, and also obviously to discuss any critical matters as it relates to clients or anything happening in our business. As Matt said, you know, we are committed to continuing to provide the level of support that we always have, and we're here for you. Colton, if you could go to the next slide, please. Thanks. So one of the things that's critical through this crisis is communication, right? We are trying as best as we can to continue to pump out communication. Obviously, this is a very fluid situation, and things continue to change on an almost hourly basis. So please let us know if you need to change where you want something sent. If you want more information on direct deposit and payroll cards to get some of those stragglers in an electronic payments fashion at some point. We do have the capability to do remote printing of checks. So if you're interested in being able to print live checks at your facility, let us know and we'll walk you through that process. Linda McMillan's going to walk through some detail on benefits administration, but again, it's critical that you're communicating with us if we are managing benefits in the system for you, as there is a lot of nuance around how we handle that, especially as it relates to ACA reporting. And if there's anything else that we can do for you, just contact us and let us know. One of the things that's kind of high on my radar is once this stimulus legislation gets passed, as soon as we can figure out how companies can access the stimulus funding to keep people on payroll, we will provide as much documentation and information around it as we can. Obviously, if that money's out there and you can tap into it to keep people on payroll, that's a great thing for everybody, and we'll try and get as much information out there as we can. Also, as it relates to funding of payroll, our ACH provider, National Payment Corporation, has asked us to be sure that we're communicating with everybody and making sure that if you feel like you may run into a situation where payroll funding is going to be hard to come by or late, just communicate with us, let us know before you actually process payroll so that we don't end up in a NSF situation and trying to chase money or pulling money back from employees, because we certainly don't want to be doing that. So again, I'll stress that communication is key. We're here for you. We want to make sure that we're doing the right things for everybody and making sure that we're taking care of you and your employees as best we can. And if anybody wants to talk further with me, please reach out either by email or by telephone. I'm here. I've been in the office for the past couple of weeks. We'll continue to be here as long as we're allowed in the building. So again, thanks everybody, and wishing you the best as we all work through this crisis.
All right, very good. So with that, we'll move over into the portion of today's webinar where we're going to recover a little bit related to the Family First Coronavirus Response Act. Some of the information that we are going to cover should not be new to you at this point, but always good to kind of go through. As Chris said, it is a very fluid conversation, a fluid situation that we're all living within. So some of this, frankly, has changed a little bit since our webinar on Wednesday. If we take a look at the next slide, the Family First Coronavirus Response Act, this was signed into law back on March 18th by President Donald Trump. One of the things that did change between Wednesday and today was the date that this law and this act actually takes effect. So the masses had been operating under an assumption that the law was taking effect on April 15th, which was 15 days post the signing of that law. Since then, we have seen guidance that it actually is to take effect on April 1st, so a day earlier. And then anything related to this act will expire as of the end of the year on December 31st. The Act affects private sector employers with fewer than 500 employees and most public sector employers. One of the questions that we've gotten is, hey, I'm under 50. Does this apply to me? So as the Act stands today, the answer is yes. If you're under 500 employees, the Act and its requirements do apply to you. Of course, we know that there is the option or the potential to apply for a waiver from these requirements if you have 50 or fewer employees. Exactly how that's going to occur or the information that's going to be required, we're still waiting on guidance from the federal government on that. That is expected to come out here in April. We're hoping, obviously, early April as opposed to mid or late April. The guidance that I have seen at this point is purely, start documenting why you believe, if you're under 50 employees, why you believe that complying with these regulations or this act would impose a financial hardship or a hardship on your operations. Hold on to that documentation, and then once we have additional information from the federal government of how to apply, that will, of course, come in handy. A couple key provisions of the legislation. The Act established National Emergency Paid Sick Leave. It also expanded the Family Medical Leave Act and also has payroll tax credit implications for any payments that are to be made under the Act. And we'll talk in detail about the Family Medical Leave Act in a second here. In terms of the paid sick leave, so this is not what I'm calling the FMLA, expanded FMLA. This is purely just the sick leave. What that did is establish the requirement for full-time employees to be provided with 80 hours of paid leave due to any number of reasons related to COVID-19, which we'll go into in a second. It also established for part-time employees the fact that employers must allot the average hours worked over a 10-day period. And I want to be careful there with that 10-day period, because that's if a part-time employee has a standard or consistent shift or number of hours. If it's variable or if it's unknown, there is a requirement to go back 6 months and do that average. If the employee hasn't been with you for 6 months, there's guidance on how to do that calculation as well. So if you do have part-time employees with variable hours or inconsistent hours, just make sure that you're calculating that allotment of paid sick leave hours appropriately. This applies to all employees under the covered employer. And then, again, of important note at the bottom there, we're talking in those first 3 bullet points about the federal act, right? Of course, we know that there's state, local, and citywide paid sick leaves as well. Here in the Philadelphia area, we've got New Jersey as the state, Philly as the local, and New York as well. These are being updated, frankly, again, as the days go by. Philadelphia, for example, from what I've seen recently, expanded their leave to require payment under COVID-19 related reasons, and also required covered employers to provide that time and to pay that time out to covered employees prior to laying them off. So, as this gets more complicated, we just want to make sure we're taking into consideration the national act as well as any other local state laws we have as well. So I mentioned that there were a number of situations under which an employee can take emergency sick leave. Per the act, there's going to be 6 of them, and that's either in response to federal, state, or local quarantine, to self-quarantine due to request by a medical provider, if your employee is experiencing symptoms of the virus and seeking treatment, to care for a family member ordered to quarantine, as many of you are probably experiencing right now on the call, to care for a child who cannot go to school or childcare due to the coronavirus-related closures. And lastly, if the employee has a related medical condition specified by the Department of Health and Human Services. I just want to pause for a minute on that first one. Some of you on the call might be saying, okay, well, aren't we all, in New Jersey and in Pennsylvania and certain other states, aren't we all under an order to quarantine? The guidance I've seen, the conversations I've been involved in, is that that's not entirely how the act was written, or that wasn't the intent for the act when this first bullet point was written. This is more if an individual person is under a federal, state, or local quarantine order, because of symptoms or because they've traveled, as opposed to the population en masse. In terms of the actual amounts of the paid sick leave, it is paid at the employee's regular rate of pay, but capped per day. So $511 up to $51.10 for the situations 1 through 3, as we just described on the previous slide. There is also a cap of $200 per day, $2,000 aggregate for situations 4 through 6. This leave must be provided in addition to any existing employer-provided sick or paid leave. And you as an employer cannot require an employee to use other paid leave before using the emergency paid sick leave. In terms of the FMLA expansion, and this may be, may be new to some of you on the call, especially if you are under 50 employees at this point, or otherwise have not had to comply with the what I'll call normal Family Medical Leave Act. So the expansion of the FMLA sets in place policies and pay requirements for employees that, again, are having to care for their children because of the COVID-19 virus. Employers who are otherwise not subject to normal FMLA requirements do not now have to comply with, again, the quote-unquote normal FMLA. The only requirement is to comply with this expanded component of the FMLA. So this is for any employee who has worked for an applicable employer for at least 30 days. Healthcare workers and emergency responders may opt out of this. And the Department of Labor, again, as we said before, may exempt employers with fewer than 50 employees if participation would jeopardize the viability of your business. For those of you on the call who are over 50 and are familiar with FMLA, one of the questions, again, that we've seen is, okay, well, if I have an employee that already took part of their or all of their 12-week entitlement across the year as defined in your internal policies, does this now mean that they get another 12 weeks? So the answer to that is no. There is still a cap on 12 weeks of FMLA, whether it's normal FMLA or expanded FMLA, for your employees who are eligible. So under the expansion, you must provide 12 weeks of job protected leave for someone who cannot work or telecommute due to having to care for a child younger than 18, or for their child care provider if that provider is closed due to COVID-19. The first 10 days of leave can be unpaid under the FMLA expansion, but the employee can elect to use any accrued PTO, vacation sick, or other time that they may have. The one interesting component here is that the paid sick leave we talked about in the last couple slides and the FMLA expansion kind of play together. So we talked about the fact that you get 80 hours of paid sick leave to care for a child or take care of a child who can't go to school or to a daycare. So those first 2 weeks are technically going to be paid underneath that paid sick leave, and then that employee is going to roll into potentially the FMLA expansion. So in all reality, all 12 weeks of this FMLA expansion are likely going to be paid for an employee that falls into this situation. And again, we've got the cap of $200 per day up to $10,000 for a 10-week period. One of the things that we unfortunately didn't have on the webinar for Wednesday, it came out right about this time as we were about halfway through the presentation on Wednesday, is the Department of Labor Employee Rights Notice. So we have since gotten that. It is hung out there in the in the handout section of the panel that you'll see. If you have not yet distributed this to your employees, you want to make sure that you do that today. There is the requirement that this has to be, posted or sent out a number of days in advance of the act actually going into effect. Again, in all technicality, this notice, just like all of your other employment law posters, are supposed to be posted in your place of business. For several of us on the call, either you're running a skeleton crew or you're not allowed into your place of business at all. So you simply want to email this out to your employees. We do have mass communication functionality within your PROXUS iSolve platform that you can utilize, but you do want to make sure that you get it in front of all of your employees. So certainly send it out through your normal email channels as well. two other things that we have hanging out there in the handout section of the control panel are documents related to the I-9 and ADA. So for those of you on the call who may still be hiring for one or multiple positions, the Department of Labor, or excuse me, the Department of Homeland Security has delayed requirements that would require you to otherwise view in person an employee's supporting documentation for an I-9, because in theory that person is operating remotely. So until 5/19 of this year, or 3 business days after the national emergency has ended, whichever one comes first, you can simply take a screenshot or a fax or an email of those documents as proof. There are certain ways that you need to complete the I-9, certain indicators that you need to say that you viewed those remotely. So you'll want to follow that guideline in the handout that we have. Once the restriction has been lifted and the flexibility is reduced, you will have to actually view those documents in person within 3 days of everything kind of going back to normal. And then the last document that we have out there is some EEOC guidance as it relates to the ADA, or Americans with Disability and Rehab Act, and what can and cannot be done in relation to what I'll call a medical exam for employees. So things like taking an employee's temperature, what type of documentation can we request from our employees? Can we force someone to stay out of work? All questions that under normal circumstances have pretty clear answers. But again, that has been provided with some flexibility and additional clarification because of the COVID-19 virus. So that handout's out there for you as well. And with that, I'm going to turn the mic over to Eileen, who will take us through some of the implications of the payroll tax credit.
Thanks, Matt. Hi, everyone, and thanks for joining us today. Colton, thank you. We know that most of you are very interested in the mechanics of the payroll tax credits. Please understand there's a lot of conflicting information out there, so what we're presenting you with is the provisions as posted on the IRS's website. We can't stress enough that this continues to be a very fluid situation. We are monitoring all the changes, and we will keep you up to date as we learn them. As Matt mentioned a few minutes ago, the credits will expire on December 31st of this year. Also, there are maximums in place per qualifying employee. So once an employee reaches the maximum, the payroll credit for that individual will end. So how is this going to affect your payroll? Okay, let's take a look. The IRS explains that under the circumstances, if an employer continues to pay its employees, even though some are home on the paid sick leave or the expanded FMLA, that company deserves some help to pay that employee. The IRS has decided to offer an immediate offset of federal payroll taxes equal to the amount to pay those eligible employees unable to work. The specific details will be released very soon, but in summary, the credit will go against the 941 tax deposit each pay period. So let's keep in mind that the 941 taxes include the employee federal withholding, both shares of Social Security, and both shares of Medicare. This credit will lower your 941 tax liability and sometimes even result in a refund from the IRS. How? Let's take a look at the examples on the next slide. Colton, thank you. In example number 1, the employer paid $5,000 in qualified sick leave and has a total federal tax liability of $8,000 for the pay period. This includes the taxes withheld from all the employees. The employer can use up to the $5,000 it was going to deposit to the IRS to help make the qualified leave payments. The remaining $3,000 of liability is due on the next regular deposit due date. In example number 2, the employer paid $10,000 in qualified sick leave, has a total federal tax liability of only $8,000 for the pay period. The employer can use the entire $8,000 to make the leave payments, make no federal tax deposit, and request an accelerated credit for the remaining $2,000. The claim form was due to be released next week. Colton? We've also learned that not only is the offset going to include your 941 tax, but it's also the non-taxable cost of health insurance for those eligible employees who are out on leave. This is just for the time that they're out on leave, though, not the entire year. This all sounds good, right? Well, the amount of sick leave credit taken by the employer will then be added to the employer's taxable income for the year, which will be reported on the company's tax return for 2020. This will reduce the overall benefit of the sick leave credit, but we'll take what we can get. On a brighter note, though, sounds like the recovery rebate checks will be available soon to most individuals and families, including an additional $500 per child. We will publish the guidance related to these credits as soon as it is made available by the IRS. Please continue to watch our constant contact emails and links within iFiles. Colton? Here are the credits per employee. Oh, sorry, Colton. Here are the credits per employee broken down. The emergency paid sick leave maximum is $5,110. The expanded family leave is $2,000. After 10 days, it becomes 2/3 of the employee's regular rate, but not to exceed $200 per day up to 10 weeks. Employers are required to post the approved notice regarding the act, which Matt had mentioned. We already have published in several different places along with a link in iFiles. So please make sure your employees receive this notice. That's all I have for now, so I'm going to hand it off to Carol, and she's going to demonstrate how all this is going to work in the iFiles.
Thank you, Eileen. I will be covering the 3 types of earnings that are going to be available in ISOP to address the emergency paid sick leave. Once you have determined the situation that applies to your business, contact your service representative to set up the needed earnings. The first earnings I want to cover is temporary paid sick. This is going to be the 2 weeks up to 80 hours of the expanded family and medical leave, capping at $511 per day for a total of $5,110. This is going to calculate the employee's regular rate. This will apply to the employees subject to quarantine related to COVID-19, advised to self-quarantine related to COVID-19, or experiencing symptoms of COVID-19 and seeking medical diagnosis. The next earnings I'd like to cover is temporary family sick. This is 2 weeks up to 80 hours of expanded family and medical leave, up to $200 per day for a total of $2,000. And this is going to calculate at 2/3 the employee's regular rate. This is for employees caring for an individual who is subject to quarantine or any other substantially similar condition as specified by the Department of Health and Human Services. The third earnings is temporary FMLA, and this is to address the FMLA expansion. This is going to be up to an additional 10 weeks of expanded family and medical leave at 2/3 the employee's regular rate for $200 per day for a total of $10,000. And this is going to be for employees caring for a son or daughter if the school or child care provider is closed. Next, I want to address part-time employees. This is going to be, the hours for the part-time employees is for the earnings temporary paid sick and temporary family sick. And it's the average number of hours they worked over a 2-week period. To override the hours for a part-time employee, you want to navigate to the employee's earnings screen by going through Employee Management, Employee Pay, and then Earnings. Select the appropriate earnings, and then in the hours, the annual hours limit field, you want to put in the override hours and then click Save. Next, I want to cover entering the hours for the emergency paid sick leave. We will add a time entry template called Paid Sick Leave COVID-19. This will eliminate the need of using individual time entry for each employee. From the time entry grid, select the template Paid Sick Leave COVID-19 and then click the Apply button. At this point, the earnings for the paid sick leave will display for the entry of hours. The last item I want to address is communication to your employees. For those of you taking advantage of self-service, you want to post that Family First Response Act poster in employee messages. Another added option to communicate updates as well as the poster would be through mass email. It would be a matter of providing the content of the email to your service representative. For all the items I addressed today, you can contact your service representative, service@proxushr.com. I also wanted to let you know that that poster is also available in quick links on your client landing page. I want to wish everyone good health, and at this point, I'm going to turn it over to Linda to review the considerations for benefit administration.
Thanks, Carol, and welcome everyone. Today I want to talk about some things with benefits if you're a benefits client of PROXUS. So let's think about what is the end result? What is your intention? Is the employee terminated? Is the employee laid off? Will benefits continue during the time away from work? Will the employee be eventually rehired? And shall I terminate or inactivate within ISOP? Next slide, please. So a layoff and a termination basically have the same result. A layoff is considered a form of termination, and the status of termination should be used on that employee. Normally, when an employee is terminated in ISOP, the system will end the benefits for that employee according to your rules programmed from your benefits analysis for when to end the benefit, such as on the date of termination or the last day of the month in which the termination occurred. This date is important for COBRA offering, as well as any electronic data carrier feeds that are fed from ISOP to your carriers. The termination date on the employee triggers both InfiniSource COBRA and coverage stop dates with your carriers. So, shall we terminate or inactivate the employee? The status of inactive should only be used to track an employee that is no longer actively working, but will return within a short period of time. For example, the employee may be on a disability, a leave of absence, or a sabbatical. The intention is that when returning to work, that employee will resume their duties as an active employee. Keep in mind that ISOP never purges the employee record. So even if you use the status of terminate and you want to eventually rehire that employee, if they are laid off, you want to use the termination status. ISOP does not purge the data on the employee, and when that employee, you want to rehire them, there is a rehire option on the employee record. So you can bring back that employee with their same information. And as an administrator, you can edit or change any data that may have changed while the employee was on a terminated status. If, as a result of COVID-19, the employee is no longer going to receive a paycheck, but you want to continue benefits during the non-paid time, this is where we would recommend moving the employee to an inactive status. But we do suggest that you allow PROXUS to create a new employment status description for the inactive status, such as COVID-19 inactive. By creating this special inactive status description, it will enable you to differentiate an employee that is inactive due to COVID-19 versus any other reason for being marked as inactive. Next slide, please, Colton. Please keep in mind that most of our clients have an eligibility rule tied to benefits for an active status. Should you decide to move employees to an inactive status, and you will be continuing benefits during this inactive status, please reach out to us. The HR and benefits team will need to update your eligibility rules to include the new COVID-19 inactive status. This is important for a few reasons. If your plans renew during this inactive time period and your eligibility rules are based on inactive status, this newly inactive employee will not be able to enroll in the new benefit plan year. If you have electronic data carrier feeds, PROXUS will need to update your carriers via Everything Benefits to include the inactive employees on the file. In addition, if you are subject to the Affordable Care Act and PROXUS is preparing your 1095 forms, without an alteration to your eligibility rules to include the new inactive status, the 1095 forms will be blank on lines 14, 15, and 16 for the months in which the employee is or was on an inactive status, even though you offered coverage to the employee during this inactive time frame. The next slide I want to talk about is the ACA measurement policy. If you measure variable paid employees to determine health coverage offering as a result of the Affordable Care Act, the system will continue to measure those variable paid employees. If the employee falls below or measures below the 30-hour per week average during the ongoing employee measurement period, there could be instances in which the employee that previously measured as full-time and is currently covered under your medical plan, they may now measure as not benefits eligible. In these situations, there could be employees in which the system will end date the medical plan coverage because it is viewing the employee as no longer eligible because they fell below that 30 hours during their measurement period. This means that the payroll deductions will not resume upon returning to work and receiving an active paycheck. So it is important for you to know what your measurement periods actually are. And if you do have a variable population and some of those variable employees are covered under benefits, if the measurement period ends and they no longer measure as considered a full-time employee, the system will automatically end date their coverage. And if this is not what you want to happen, you want to make sure that you're viewing end dates on either the benefit carrier feed report or the benefit carrier changes audit report so that you can look at those benefit end dates and make changes if necessary on the employee benefit plan record. One thing I want to point out that's not in our screen, and Matt will touch on this later, is collection of missed premiums upon return to active work. We do have a feature within iSoft called arrears that can collect a missed premium when an employee returns to work. It will look and see that premiums were not collected, and upon your payroll processing, you can either collect it all at once or you can place a goals balance and enter a maximum amount per check to be collected. So if you are offering medical plan benefits or any benefits during this time period while the employee is not actively working, keep in mind that the arrears function is an option for you should you wish to utilize that. And you can contact your service representative here at PROXUS. Thank you. With that, I'm going to turn it back over to Matt.
All right. Thanks, Carol, Linda, and Aileen. So several of you had submitted questions when you registered for today's call. As I said when we first got started, we were receiving them and still kind of a couple questions rolling in here. So we'll move on to those next. In the interest, again, of time, we're at about 38 minutes now, so definitely going to be going over that 45-minute mark. I did just want to make note of a few important things, specifically related to the benefits that Linda just went over. One of the things, and kind of goes back to my opening comment about businesses being creative and being flexible, and kind of doing the best that we can to support everyone at this time. I have seen specifically related to Independence Blue Cross that they will continue coverage for employees who otherwise would lose that coverage based on layoff or a reduction in hours, so long as the premiums continue to be made and a few other qualifying reasons. But Independence Blue Cross is, again, being flexible and allowing employees who otherwise would have lost coverage to continue that coverage past that, what I'll call COBRA qualifying event, based on the situation that we're all experiencing. Certainly with any of those plan guidelines, plan regulations, you're going to want to reach out to your benefit broker. They're going to be the ones that can help you navigate all of that. Frankly, I don't know as I sit here right now whether there's other carriers that are doing something similar to Independence Blue Cross, but did just want to put that out there on the call, that may be something some of you want to look into with your benefit brokers. The other point I wanted to make was related to FMLA. So anyone on the call who is subject currently and was previously subject to the normal FMLA, You heard me mention that this expanded FMLA based on the Act does not require or does not allow for the employee an additional 12 weeks. You do just want to be careful, though, as you read your internal FMLA policies around the 12-month period and the way that you define that. So I would imagine that most of you on the call have what's called a rolling look-back period, which means that the 12-month FMLA period starts and ends for each employee as they start an FMLA claim. Some of you on the call may have just a January to December calendar view, in which case, if you did have an employee who went out on FMLA for the last 3 months of 2019, they would be entitled to another 12 weeks of FMLA time starting now because you have a calendar view. So it will be important for you to take a look at those internal policies, reach out to your HR department, reach out to us here. We can help you with that. But just wanted to make sure I made those 2 points here in case anybody did have to drop off. A few reminders, like we said, the following are pre-submitted questions that were sent prior to today's webinar. The information is what we know as of today, is based on our interpretation, and is more, again, for educational purposes, should not be relied on for legal advice. Definitely, if you have concerns over the implications of any of this, you may want to reach out to your employment attorney, and any questions that were submitted during the webinar will be addressed afterwards. So there's a number of things that go into play here, right? So we obviously have the requirements of the Act itself, but none of the other laws and the kind of alphabet soup that we all deal with on a regular basis go away. So things like the ADA, the FMLA, the FLSA for compensating employees, the WARN Act if you're over 100 employees, your internal policies, all of those still remain in place. And we just have to kind of maintain awareness of how these relate to each other. One of the questions that we saw come up quite a bit is related to unemployment and how, if at all, limiting employee hours affects the unemployment payments for those who might qualify. It's a great question. And, if you're here within the state of Pennsylvania, employees can continue to work reduced hours and they will receive either full or partial unemployment benefits, depending on the amount of earnings as compared to their partial benefit credit. I did hang out there for you the link directly to the unemployment website for the state of Pennsylvania. And then also right below that is a Department of Labor sponsored website, Career One Stop. So if you do have operations in states outside of Pennsylvania, you can go to this link here and it provides a nice, drop-down menu of the 50 states and anywhere else where unemployment would be applicable. You can simply click that location or that state that you're operating in and it'll pull up the relevant information. Next question that we had in was, how will the employee 2-week paid sick leave be received by the employer from the Act? As Eileen covered earlier, it's simply going to be a tax credit towards the total federal 941 liability for the pay period. How do we handle PTO for employees who are filing for unemployment? Do they need to be paid for all they have accrued before they can file, or can it be saved for when they return to work? Here again, like I said, this is where we get into a little bit of that interplay of your internal policies and the rest of all of this, right? So for employer-provided time off, taking time off to mean either PTO, vacation, sick, personal time, however you define it, you're going to want to follow your internal policies and practices. So if you are truly laying somebody off and terminating them, your policy may be that that time is paid out. If you're furloughing somebody where the intent is that they will be brought back to work, or that you're just reducing their hours to a very bare minimum, again, you may require them or you may allow them to use it if they request to, but it's going to depend upon your specific situation. If someone is paid out for their time and then they apply for unemployment, it may reduce the unemployment credits that they are then provided. The big thing here is going to be consistency, and you'll hear me say that a few times as we go through the questions. Just make sure, as we would advise before all of this, that the decisions you're making are consistent across the organization. You want to make sure that you're not adversely impacting any one particular employee or class of employees by the decisions that you're making. Employees may qualify for the emergency sick leave. And again, keep in mind the state and local leave laws. We talked about Philadelphia expanding their sick leave and requiring that employers pay that out before laying off an employee. So you're going to want to refer to that as well. So I have an employee who works full-time. They're collecting their Social Security benefits. Most of the small workforce is going to be laid off. Will this group or this employee be eligible for unemployment? And if so, will that affect the amount that they might claim? Based upon the Pennsylvania Unemployment Benefit Handbook, it does not appear that the unemployment benefits will be affected. We've got a couple links down there at the bottom, including the one again that can direct you to states outside of Pennsylvania. And that's where you'll want to go to see specific regulations, as this may vary by state. A lot of questions related to the tax credit and how it's going to be tracked and handled. Will payroll be able to accommodate this for us, or do we need to do a separate filing? So Carol touched upon that. We have updated the platform to track information related to both the sick time and FMLA leaves as related to the Act. And this includes both the percent and dollar caps on those benefits. Touched upon this one a little bit just throughout the presentation, but the question was, we fall under less than 50 employees. Which guidelines impact us, and how can we learn more about the waiver we could possibly apply for? So the answer to that, again, multiple moving parts here. The Family First Coronavirus Response Act, as it sits today, applies to all employees under 500 employees. So we know that there is going to be that waiver. Again, not quite sure as it stands today on the 27th how exactly you're going to go about applying for that, but we will push that information out as soon as we know more. If a team member is exempt and does not have childcare on Monday and does have childcare for the rest of her schedule, can she apply for partial sick leave for the 8 hours? That's another great question that we've seen kind of coming up more and more as this progresses. People are starting to come up with unique situations. And for those of you who are familiar with the normal FMLA, there is what's called intermittent. So essentially taking that time off in pieces, right? The important part with this question is the word exempt there on the first line. And whoever posed this question knew exactly what they were asking, because under normal FLSA, so Fair Labor Standard Act guidance, exempt employees do have to be provided with their full weekly salary for any week in which they work any time. So for example, if an employee works for half a day on Monday and then does not work for the rest of that week, under normal FLSA guidance, that employee does have to be paid their full weekly salary. With FMLA and with the partial sick leave here, we are seeing guidance that flexibility is able to be had, right? So if you were going to have an employee who did not work at all on Monday because there was no childcare, and that's an important distinction, right? So they should not be checking email, they should not be taking voicemails or taking phone calls. They should truly be removed from work for Monday. You can supplement that weekly salary with the 8 hours of FMLA, or expanded FMLA in this case. The Act doesn't specifically speak to this or necessarily allow for or disallow for this. The guidance that we're getting is that a lot of this just comes down to common sense, right? The alternative is that you say, no, and you can't work a partial schedule, and then you get no productive work out of this employee. But being a little bit flexible here and allowing for that scenario is what we're hearing is the guidance. Team member also has health insurance with us and would be dropped below full-time status. Is it better for her to use vacation hours for those days, or where we pay her the full salary? So the definition of full-time, again, you're going to want to check with your benefit broker here, but it's very likely that the definition of full-time for qualifying for medical would be 30 hours, in which case if this employee is still working 4 full days, they're going to be at 32 and would still qualify. You heard me say a couple minutes ago that some carriers are being lenient here. So again, if you're with Independence Blue Cross or you're with another carrier, check with your broker on how best to handle that. How will iSolve track the emergency paid sick leave and FMLA leave due to COVID-19? So that's exactly what Carol went over before. We've programmed in these earning codes to track the applicable time off. We're still awaiting guidance on the IRS on the mechanics of the FICA credit, and we'll certainly get that out to you once we have it. And you all should know your dedicated client service representative, so please do reach out to them directly to set up each of those codes. Talked a little bit about it already, but how does this affect health insurance? A lot of you probably cost share with your employees, whether it's an 80-20 split, 70-30 or something thereabouts. How can we cost share when there are no employees working? Do we still need to offer the insurance while we're closed, or do we put everyone on COBRA? Again, it's going to be different for everyone. It's depending on how you're classifying employees during the business closure and how you wish to handle that cost share. Your brokers are going to be a valuable resource here. If you do lay somebody off, if you do furlough someone, there may be implications related to re-eligibility when and if that person is brought back. But if you are continuing benefits for employees during a business closure, you can certainly consider having them write a check for the portion of their coverage that is otherwise not being collected each pay period. Or if you are in a situation where you're able to continue paying that full premium, both the employer and employee contribution for a period of time, you can certainly do that. And then as Linda said, we do have the arrears functionality within the PROXUS platform to be able to capture that once we are back to normal and those employees are again working. With COBRA, so if you do decide that COBRA is the best option or COBRA is required for some particular reason, keep in mind that the employee is going to be responsible for up to 100% of the premium unless you as an employer elect to continue the normal cost share. We have up to 102% there because if you are administering COBRA internally, so if you have an HR person who is sending out the COBRA forms, you do have the option to collect 102% of the normal premiums for the administrative burden of having to administer COBRA. If you have a third party who manages COBRA, it's very likely that they are charging 102%. You would check with them and they would be able to tell you what percentage they are charging. As I mentioned, benefit carriers are relaxing some of their policies. And once you have determined the direction to take, please do make sure that you contact us so that we can set up the appropriate status code within the system. As Linda mentioned, there are implications here for ACA and otherwise, so we just want to make sure that whatever status code we are using is the appropriate one. What documentation can you require for someone claiming to need self-quarantine or to return to work following exposure? So this gets a little bit to the one handout that we have there in the panel related to the EEOC and ADA. But as we all know, doctors and other healthcare providers, they are overwhelmed at this point. It's going to be a hard ask for them to complete a fitness for duty or other documentation. Certainly for those of you familiar with the FMLA documentation, that paperwork, has a 15-day return time to begin with. It is fairly cumbersome. The likelihood is that, doctors, physicians, or anybody at those locations aren't going to have the time to allow for that or to complete that. So new approaches are going to be necessary, and it just comes down to common sense. So reliance on local clinics or hospitals to provide, an easy form, a stamp, or an email to certify that an individual does not have the virus if they're to return to work. And when I say common sense, right, so this act technically does not go into effect until the 1st. So if you have an employee who's been working from home and, performing well between now and April 1st, April 1st comes along and they say, hey, I can't work anymore. My childcare concerns have required me now where I'm going to need to be paid out the paid sick leave. The question is, okay, well, you were able to work prior to April 1st. What changed? So it's just like under normal circumstances, there is the potential for employees to try to take advantage of certain situations. So if something just seems a little off or seems a little funny, you might want to push back. I had the conversation yesterday with one of our clients. We are all, employees included and employers, getting communications on a regular basis from everything, from our grocery store, from our physicians, from our local deli, whatever it might be. So if someone is claiming that their child's daycare or school is closed, it's very, very likely that they have an email or some other communication. So you may just want to simply ask for that. Again, if you do it for one, make sure you do it for all and attach that to their file. That way, at least you have some supporting documentation to support that request. Are furloughed part-time permanent employees entitled to accrued vacation and sick pay? Are those same employees eligible for unemployment comp? Is it better for them to lay them off and rehire them? So again, it depends. It's going to depend on your internal policies as to how accrued time is used or paid. If you do have a policy or a practice of paying out that time if somebody is terminated or furloughed, you would want to maintain that consistency. If that policy is not in place as of today, just rely on your past practices and precedent. And employees who are experiencing a complete or partial reduction in pay may be eligible for unemployment compensation. Just taking a quick second to read this one over. So we have a company that's less than 500 employees. They're considered life-sustaining business, and they have an employee who has not been advised by a healthcare provider to self-quarantine, is not experiencing COVID-19 symptoms or seeking medical attention, and is not caring for anyone. So again, back to those reasons 1 through 6 of potentially being eligible for paid sick leave or expanded FMLA leave. This employee does not qualify under any of those and simply wants to, be safe and self-quarantine. Is that person eligible for sick time? So if they cannot work from home, then they are not eligible for sick time. So the base requirement is that, to be eligible, you have to be unable to work for some particular reason. In this case, an employee may want to use vacation, sick, or other time, given your internal company policies. And again, back to the alphabet soup here a little bit, we've got the implications of FLSA exempt versus non-exempt. So if this person is a non-exempt hourly employee, they do not need to be paid if they do not perform any work, right? So that's the same as several months ago. That'll continue to be the same after we get through all of this. If a non-exempt employee is not working, they do not have to be paid, but they may have, again, PTO or other time off leave available. Exempt is a little different. So you heard me say before that if an exempt employee works, half a day on Monday and doesn't work the rest of the week for certain reasons, that they do need to be paid their full weekly salary. There are very, very limited exceptions of when that can be changed and when you can actually deduct from that weekly salary. One of those is if that person is staying home for a personal reason. Under the question that was posed, this person is simply saying, listen, I personally want to stay home. I want to self-quarantine. I'm trying to protect myself. This would be viewed as a exception under the FLSA for the full week, in which case that employee does not need to be paid for that day or that week. Again, though, if you call them, if they pick up the phone, if they send an email, then you would be in a position where they needed to be paid. Due to the significant downturn, we've been forced to lay off employees and will probably be forced to lay off more. What are the employer's responsibilities under the Act with regard to laid off employees, anyone who will be laid off prior to April 1st and anyone laid off between April 1st and December 31st? So we've got a couple different time periods here, right? If you have specific questions, you're going to want to contact your employment attorney. But with the information that we have right now, our interpretation is that employers have no obligation under this act. Keep in mind what I said prior about Philly sick leave, and you'll want to check with other local paid leaves that you may have. But under this act, there is no requirement to provide paid sick or expanded FMLA until April 1st. So anyone that's been laid off prior to April 1st, there is no requirement. After that point, if somebody does fall into one of those 1 through 6 characteristics, then they would be potentially eligible for the leave. FMLA guidelines do not necessarily protect an employee from being laid off if they're on FMLA, so long as their entire department or division is laid off, or that the reason for layoff is not specifically related to their being out on FMLA. So even if you do have employees who are with you past April 1st, and then you get 2, 3, 4 weeks into this and layoffs need to occur, I would again highly suggest to reach out to your legal practitioners for guidance on that. But you may be in a position to be able to lay that individual off under certain circumstances. All of our employees have been laid off since 3/16. Last day of work was 3/15. Do they qualify for paid sick leave? Here again, very similar to that last question. If they were laid off prior to April 1st, then the guidance is no. Is there any other communication I need to have currently? The Department of Labor poster that's in the handouts and that we've since distributed otherwise is what needs to be sent out right now. The big thing here is, employees are going to look back on how employers handled the situation. What communication was coming out, if any, how frequently was the communication. So you want to make sure that, aside from what you have to put out there, think carefully about what you might want to put out there, what would be relevant for your employees, just checking in to make sure they're doing well, and having a little bit of that empathetic communication with them. But in terms of required communications, the one would be that DOL poster. Are there rules when we're allowed to reopen as to who or how many employees can be called back, especially not knowing if there will be social distancing rules? So here you're going to want to defer to state, local, and federal government in terms of when businesses are able to reopen, particularly around the social distancing and the number of people who may be allowed to quote unquote gather. The other thing, related to the WARN Act, if you are a large enough employer to be subject to the WARN Act, you would want to do some research there in terms of the callbacks and if there were any implications. Yep, so we can go to the next question. So that seems to be it. I do have one here that actually came through an email that, if everyone bears with me, I'll pull that up and can address in real time. So similar to some of the other questions we have, a small nonprofit organization, 57 employees. So on March 16th, that organization laid off 7 employees because Governor Wolf mandated the closure. Employees are working remotely, but additional layoffs may need to occur. So would these employees be eligible for sick leave under the act, or can we still lay them off? So it depends. In order to be eligible for sick leave pay, you need to fall into one of those 6 categories that we discussed before. If there is no qualifying reason, then yes, they can still be laid off. Again, this organization seems to be outside of Philly, so the Philadelphia sick leave would not apply. Can we lay off employees with school-age children, or do they too fall under this act of sick pay followed by FMLA under the act? So again, it depends. If they qualify for one of those 2 reasons, then they may be eligible for the 2/3 salary continuance up to the maxes that we talked about earlier. The one interesting thing with this is, if we're at 57 employees to begin with, and we've already laid off 7, if you lay off, 1 or 2 more, at that point, you will be under the 50 employee mark. So you may be able to apply for the waiver or the exemption from having to comply with these regulations under the Act. So something to consider there: if you do drop below 50 employees, is it best to pay the sick or FMLA, or do you want to apply for that waiver? It's going to come down to culture and the communication that you want to have with your employees. So last couple slides here, helpful resources in addition to those that are out there in the handouts. Number of different websites here: Center for Disease Control, state websites, Department of Labor. We've linked you there to the poster as well. So all places that you'll want to check. As new and additional information comes out, we will certainly be compiling that and sending that out as well if you want to use us as a central resource. But these are some additional resources that you may defer to. And with that, we have set up a specific email box for anyone that has questions that they want to direct in. This email box is being monitored by our team. So if there are any questions specific to your operations or that we didn't cover here on the presentation, please do feel free to send them in to covid-19@proxushr.com. And with that, we thank you for your time today. We'll continue to keep you updated on relevant information as we know more, and stay safe and stay well. Thanks, everyone.